Welcome to Local Edition on Time Warner Cable. I'm Steve Swatt with the California Report. In the next few minutes, we're going to talk about efforts at the state capitol to find new money to help prevent a shortfall in Medi-Cal. My guest this segment is Marc Levine, a member of the State Assembly from Marin County. Thanks for being with us.
Well, thank you so much, Steve. Very glad to join you. Last month, Governor Brown called a special session of the legislature to deal with public health and developmental disabilities. The federal government has informed the state that a current tax we have does not meet their guidelines, and because of that, they will withhold $1.1 billion in matching funds that the state uses to fund Medi-Cal. This is incredibly important because Medi-Cal covers over 9 million Californians, including 5.2 million kids. These numbers are pretty staggering. It's nearly half of all children in California. And I think if you were to ask your friends or neighbors how many kids rely on this program, they would be very surprised by this.
And these are really our most vulnerable citizens.
These are our most vulnerable citizens. They can't afford health care. They end up likely at the emergency room for minor matters if it was caught earlier. So, in fact, not providing Medi-Cal would create a surge in health care costs, and we're trying to contain those costs and make them as low as possible for everybody.
So as we tape this interview, the special session is still ongoing, and so this issue has not been resolved yet. But your proposal that you have authored, would increase tax on healthcare plans. Correct?
So I'd prefer to say we would repeal a tax that does not meet the federal guidelines, and then we would replace it with one that does. It's perhaps an increase for some plans, but a decrease for others. But it is what the federal government would require, a broad approach that creates a sustainable funding mechanism. So this tax on managed care organizations would be a flat tax, fair and equitable for every health insurer. And this would perhaps bring the federal matching funds that we need so badly in California.
But there would be an increase, nearly $8 a month for consumers.
That's right, but you would think that it would be an increase but it's there's already a current tax. Correct. It just doesn't meet the system. We're replacing it with another fairer, more equitable tax.
Yeah, you do say it's basically a replacement. The Republicans are still are holding fast, suggesting there's a better way to do it, and that is we have many billions of dollars in surplus funds in our budget funded out of the budget.
So it's a great argument to make. However, a lot of the money we have in our budget is guaranteed to go to education. We have some money in Prop 2 for a rainy day. This doesn't quite meet the qualifications for rating education or even the rainy day fund. If this billion-dollar deficit gets opened up, how do we sustain that for the long term to make sure that over 9 million Californians have access to health care? That's not something that we can create a solution just for 1 year with one-time money. As we know, our economy is incredibly volatile. We are dependent in California on capital gains taxes, so any fall in stocks will greatly impact the state budget, and we need to protect ourselves from years of deficits like we had in the past.
There's been another proposal of increasing the tobacco tax and using those funds for Medi-Cal.
That's right. So in the special session, we're looking at Medi-Cal reimbursement rates, which were cut during the recession. We're also making sure that the federal matching funds that provide Medi-Cal coverage for millions of Californians is also there. They're both related to Medi-Cal, but different pots of money. We're also trying to figure out how do we take care of Californians with developmental disabilities or people who can't live independently without a little bit of help. And we're trying to find funding sources for that to make sure that we don't incur greater costs by bringing Californians into state-run hospitals.
All right. Well, we're out of time for this segment, but it's a very important discussion, and thank you, Assemblyman, for coming by.
My pleasure, Steve.
And thanks to our viewers also for watching Local Edition on Time Warner Cable. A reminder, you can see this and other interviews on the California channel, on My Government On Demand, also on YouTube.